Welcome to the Minority Health Report with Dr. O. I'm your host. May is National Mental Health Awareness Month, and I wanted to speak a little bit to mental health and mental health awareness, especially as it affects us in the minority population. Mental health problems affect our physical health in more ways than one. But before we get started, let's define a few things regarding mental health. Mental health problems involve changes to our thinking, our emotions, or our behavior. And these changes affect how we interpret things around us and how we relate to things around us as well. Sometimes the effects of it are external, where somebody else can notice or see. Other times, and a lot of times, the effects are actually internalized, where nobody else is seeing that you're going through things, but these things are affecting you on the inside. In the African American population, in the Hispanic population, in every population, there's an abundance of mental health issues, but it's a particular challenge in the minority populations because of cultural and sometimes religious attitudes, where we tend to either ignore or deny that these problems exist. You know how it goes. You grew up in church, you grew up in a religious environment, and you believe that God can solve all your problems, and therefore you don't appreciate or you don't accept that you're having a mental health challenge. And sometimes it will appear as a weakness to admit that you need help with things that's going on in your life. There are lots of reasons why mental health is a big issue in minority populations. Some of those include specifically socioeconomic stressors and triggers. These include things like unstable jobs, broken relationships, money problems, unsafe neighborhoods. All of these individually and collectively can affect how we relate to the world around us and affect our health in more ways than one. Unfortunately, many times my patients come to me, and even when the answer is so obvious in front of them, they refuse treatment because of the taboo of mental health. We know there are all kinds of derogatory ways to talk about mental health in our communities. Oh, he's cuckoo, he's crazy, he's a basket case. Oh, and sometimes our appreciation of mental health is different from what we are manifesting. For instance, a lot of people assume that depression only means when everything is gray and you're sitting in a corner and not moving. And some people don't realize that depression can affect your sleep and keep you up at night, and that might be the only sign of depression that you have. Depression might affect your ability to want to do things. Depression might affect your ability to recall events or stay focused on a job. I remember many years ago, a patient of mine who had just received her online MBA came to me asking to be evaluated for early onset Alzheimer's. And I was asking, why do you think you have Alzheimer's? She was in her mid-30s. And she came up with all these different reasons why she thought she had Alzheimer's. And she just graduated an MBA. And when we delved into it some more, it turned out she had finished school. It was more than 6 months. She hadn't got a job yet. She thought she would be a hot cake in the job market, but that hadn't happened. And she was having difficulty sleeping. She was having difficulty concentrating. And boom, she thinks she has Alzheimer's. This is just one of many samples of how we misinterpret what's going on with us. There are physical manifestations of stress and anxiety. I've mentioned some of them: lack of sleep, short-term memory loss, but there are lots of other things. Some aches and unusual aches and pains in different parts of the body. These can be physical manifestations. There are also medical manifestations that can be related to poor mental health. These include strokes, heart attacks, GI issues like irritable bowel syndrome. These have been confirmed in medical literature to be more abundant in a population with increase or predominance of mental health issues. So mental health is not to be taken lightly. Because you're not bleeding out, because there's no broken bone, does not mean that mental health issues are not just as important. It is important that we recognize it in our communities. It is important that we call it for what it is, and it's important that we seek help when we need the help to meet the challenges of the modern day. Other consequences of poor mental health might include difficulty on the job that might lead to job loss, difficulty concentrating, like I've mentioned already, broken relationships or difficulty maintaining relationships because of unresolved mental health challenges, substance abuse. Lots of people take to drinking or using drugs to deal with the unresolved mental health issues. And unfortunately also the ultimate suicide, which comes from unresolved mental health issues as well. A lot of times the roots of our mental health challenges might go deep, especially things like childhood trauma. In men and women, sexual assault, more predominant in women, but also in men. We are all aware of the stories that came out of the Boy Scouts scandal, as well as the Catholic priest scandal. These assaults that happen to young people can develop deep roots if not properly addressed and resolved, would lead to ill health as an adult. There are lots of ways to deal with mental health challenges, from as simple as talking to someone about it, someone that you trust, to all the way to seeking medical help to help deal with your mental health challenges. Having a group of friends, close relationships that you can share things with, you can share your challenges and your victories with, is very helpful. Having a close-knit group of friends to do things with is very helpful. If you're married, confiding in your spouse. If that is not an option, confiding in close associates, it can be quite helpful. Speaking to a certified therapist who is trained in handling different types of mental health stress. Now, remember also, there are different specializations in therapy. So depending on what challenges you're facing, would determine what kind of therapist you might need. But these are important interventions that could go a long way to help. A mental health counselor comes in very handy in situations like this. We all know that we have the suicide hotline for people that are feeling suicidal. We don't want to wait until we're feeling suicidal to reach out for help. Unfortunately, by that time, things have gone unresolved for so long that people will resolve to taking their own lives. So I'm advocating for intervention well before we get to that stage. Talking to your primary care doctor, even when you're not sure, go have your doctor evaluate you. There are some very simple tools we can use in the doctor's office to assess your for mental health issues, whether it's anxiety or depression, and prescribe appropriate medications. In my experience in primary care, I have seen patients come to me with different manifestations of what turns out to be depressive symptoms. But as soon as I mention depression, they recoil and they don't want to take medications. I have told my patients several times, it's almost as if somebody was more willing to accept a diagnosis of cancer or liver failure or whatever, heart failure, than to accept a diagnosis of depression, even when it's so obvious to me, and even when I show the patient my evaluation results of the patient. So learning to accept that depression and anxiety can manifest in ways different than what we think, it's also important for us to recognize the role it plays in our lives. Lastly, a healthy lifestyle is very helpful to help deal with stressors in life. For instance, when we exercise, your body releases what we call endorphins. These are feel-good hormones that bathe your brain and your body, and you feel momentary high after exercise. The same kind of high you have when you're in love, when you've had a good meal, when you've taken a nice vacation. Those kinds of feel-good sensations can be released in your brain when you exercise or when you engage in recreational activity. Everybody has their different ways of relaxing, but finding ways to relax and recreate helps recharge you as a human being, and this is important for all of us. So I want to encourage that we find ways for stress relief. Whatever exercise that you like to engage in, whatever kind of recreational activity you engage in, it's important to do that to help with stress. Finally, don't forget, if you need to be on medication for anxiety or depression, please do not neglect to do so. Speak to your physician who knows you better, and we can come up with a good management solution for you. And when all else fails, referral to psychiatry for proper evaluation and treatment is also important. So, in this May month of National Mental Health Awareness, I want to encourage all of us, take care of your mental health. It's just as important as taking care of your physical health. Thank you for listening. For those of you in the Charlotte area, stop by and say hello at Crown Clinic on 4500 South Tryon Street. Thank you. Take care of your health. God bless you.